time around, like I told you, let's delve into health issues. All right, let's discuss health. All right, the doctor is on his mic right now, very very close, very very close. Dr. Charles Adiogun is in the studio. Good to have you again, Doc.
Yeah,
Good to
good
have you.
morning. Good morning.
Good morning.
Thanks for
Good morning to you. All right, let's get talking. There is okay. Everyone, feel free to join the conversation. You can send in your questions. All right. Yeah, your questions basically on WhatsApp. 081 is a WhatsApp number. Let's talk to you and you talk back. Okay, it's very simple. 081 Now, there is this thing that's been going on, for a very long. I don't know. It's been so disturbing. It's been taking lives. Fibroid. I'm aware that a doctor will be joining us any moment from now. When she'll be in the studio. Very very soon. I want to have this conversation with two doctors, but then let's begin with Dr. Charles Adeogun here. The issue of fibroid, it's crazy, and infertility alongside. Some persons are relating infertility to fibroid. The reason why you're not fertile is because maybe you have little fibroid inside you and all of that. But some persons really don't know. When you say fibroid, they're confused. What is fibroid? They just hear the name fibroid. They don't know what it is exactly. So I would like if you could break it down for us, for reasons, for some persons are listening to us right now who really don't or want to understand what fibroid means and what it affects. So help us break it down.
Thank you. So fibroids amongst Africans, especially women in their reproductive age group, is not something that is uncommon. So a lot of people must have heard what the term is. But fibroids basically refers to a non-cancerous growth in the uterus, in the womb. It is not cancerous. So it is usually composed of what we call smooth muscle and connective tissue. That is what makes it up.
Okay.
So basically, it can be found in different parts of the uterus. So depending on the location of where it is in the uterus, that the uterus is called the womb. Depending on the location, it has a name for it. You can have it in the muscle, embedded in the muscle of the womb, and you call it intramural. You can find the submucosal type of fibroids. You can have the subserosal type of fibroid, depending on the location. And then one interesting thing about fibroids is that, first and foremost, when somebody hears that they have fibroid, they're always thinking, oh, do I need a surgery? Am I going to conceive? Is it cancerous? First and foremost, it is a non-cancerous growth. And then secondly, it's common amongst people in their reproductive age group, particularly people of African descent. It's quite a common finding in them.
People, I want to ask why Africa, why?
Well, some theory have been postulated that has linked fibroid to something relating to vitamin D deficiency, and then it has been shown that the darker your skin is, you may actually have vitamin D deficiency.
For real?
Yeah. So some school of thought are addressing it in that line, and then also when a woman has fibroid, there are some important signs that or symptoms that she'll be experiencing. For instance, the commonest ones would be having heavy menstrual flow.
Okay.
And apart from it being heavy, you can also find out that the duration of the menstrual flow is elongated. It's longer than usual. So normally you find the person bleeding for up to 7 days or more, and then the person is having a very heavy flow, and then there may also be pain. The fibroid may undergo some complications we call red degeneration.
Okay.
That is a very painful thing that happens. And then also they may also have pressure symptoms. Depending on the size of the fibroid and the location of the fibroid, you may find some fibroids impinging on the bladder. So you find that such a woman will be having the need to want to frequently urinate because of the pressure on the bladder. So she will always feel the need or the urge to go to empty her bladder because of that pressure. Then also you can also find out that people that have fibroids may also, because of the heavy bleeding, you may see that their blood levels may be dropping. And then They may also have fatigue, they may have tiredness, dizziness, because when you're losing a lot of blood, you would certainly present with these symptoms. But the good thing is that fibroids can coexist with pregnancy. Fibroid is not a defined
I thought they say
reason for
it kills
infertility.
pregnancy.
You can get pregnant. A woman can get pregnant while having fibroid. Fibroid does not stop conception, because the baby would have his own space, and the fibroid, of course, is occupying space in the uterus. It can come up with other complications, but it's not going to be a major source of a woman not conceiving. So it's possible for pregnancy to coexist with fibroids, and fibroids have been known to increase in size during pregnancy.
But can it shrink
It can-
pregnancy?
Well, to an extent, it can cause what we call intrauterine growth restriction, because it's occupying the same space as the child. So if it's so big, it's leaving little space for the child to actually grow effectively. So it can actually, cause some form of growth restriction. And then depending on where it is, if it's found towards the cervix area or blocking the outlet of the womb, then you can also have difficulty in labor, and then the child may have to be delivered by cesarean section. And apart from that, fibroids can also put up some complications, especially for people that have big sized fibroids. If a woman delivers, she can have problems with postpartum hemorrhage. She may bleed heavily after delivery, because the uterus should actually contract properly to stop the bleeding after delivery. The moment the baby is out and the placenta is out, you need an effective uterine contraction to stop the bleeding. But if there is something occupying the uterus that the uterus is accommodating, that is not allowing that effective contraction, then you may have postpartum hemorrhage, and the woman may bleed torrentially after delivery, and that is a complication that is fatal in some women, because stopping bleeding after delivery is key for a woman's survival post-delivery. Then fibroids also, they shrink in menopause. So for women that are advanced in age, between the ages of 45 and 55, the average, most women around 51 attain menopause. So around menopause, because of the hormonal changes and the decline in estrogen levels, we find out that most women that have fibroids will notice a shrinkage of their fibroids, and they may not worry too much about going for a removal or doing a surgery anymore, because naturally the estrogen decline in that age bracket will shrink the fibroids. So for most people who are advanced in age, we really don't worry about it. That's why you can rarely find any woman who is a granny that will say her problem is fibroid. It's almost impossible. But by the time you get to menopause, all the things that feed it are not there anymore.
Now, you made mention of the fact that it's something that has to do with the black race, right? Does it mean Oibos don't have fibroid?
You never say never. It's not that they don't have it, but we're just saying it's more predominant in people of African descent. It's something that is more, it's common, because in medicine and in health and in public health, there's epidemiology. You have a lot of statistics monitoring the prevalence or incidences of diseases, knowing what is prevalent amongst which group. Just like you have some illnesses that are predominant amongst Caucasians and Asians and all that we in Africa are, exempted from. So there are some things that are peculiar to different races. So the same applies to fibroids.
Just like I heard some person say, every woman has fibroid. Is that true?
Every woman in their reproductive age group is likely to have fibroid. There are some women that may not. Some people go.
Every woman.
Nothing is absolute. Sometimes you have women that go for their pelvic scan, you take a look at it, and nothing seen, no masses seen, everything intact, endometrial lining fine, period regular, no problem at all. But it is very likely that so far the woman is in a childbearing age bracket, it is not uncommon to find fibroids. And if you find it, it's nothing to worry about, because it's the size that actually determines the size and the number and the location of the fibroid. Sometimes you have some people that have fibroid just tiny, like a seedling. It's very tiny, like a ball, small ball, and no symptoms, no pain, no heavy bleeding, no discomfort, nothing. And it's just a finding, and they are told not to worry about it. But when it becomes big and it becomes symptomatic and it starts affecting the quality of life of the individual, then something is done. In extreme cases, you have giant fibroids as big as a whole baby, like a 4 kg baby. You have some massive fibroids, and they can be very numerous. In those kind of people, you may need to do a procedure called a myomectomy.
What's that?
A myomectomy is a surgical procedure of removing fibroids. So the fibroids are extracted, and whatever you take out, in surgery, you send for histopathology. Histopathology is you analyzing what makes it up, just to be sure that it is nothing to worry about. But fibroids generally are not cancerous.
Some persons will tell you fibroid grows like, I don't know. You just mentioned that this very huge big one. I don't know, why is it like that, really? You find out some persons, okay, like a lady will tell you, well, they said I had fibroid while I was at age 25, and it's still very little, you understand? And some will tell you just at age, say 30, theirs is that big, as if they're pregnant.
Yeah. That is why, you can't compare your health status to another person's health status, and you cannot compare genetics. Some people are obese. Some people have a tendency of having some hormonal imbalance, and then some people, generally because of the kind of family they come from or what exists in their family line, they have the tendency to develop certain illnesses or certain conditions than other people. So you can indeed find a woman who has fibroid, and you may mistake her to be pregnant. You may actually think she's pregnant or she will be delivering soon, and she's not actually carrying a baby. It's just all fibroid.
Okay. Now let's look at it. Can a lady who is age 18, 19, 20 have fibroid?
It's not.
Have you seen such conditions?
It is not impossible, because you find them once you have started your menstrual period. Once you are in your reproductive age group, you have normal menstrual period. You have estrogen levels that are normal. It's not impossible, especially people of African descent. Like I said, it's not unusual. But the size is what matters, and the number. Is it solitary? That means, is it occurring singly, or is it multiple? And where exactly is it? Sometimes it's at the fundus, sometimes it's in the muscle, sometimes it's submucosal. It can be anywhere, around the womb. But the important thing to watch out for, what are the red flags? What are the symptoms? And those symptoms are what we've mentioned: the heavy periods, the pain, the pressure symptoms. And then sometimes it can be so much that you can have the veins, the IVC obstructed, the inferior vena cava obstructed, and you can also having varicose veins, edema, and swelling, of the legs. That can also happen because it has compressed so much and has obstructed the flow of blood back towards the heart. So those are the things that you can actually see in people that have fibroids. And like we said, fibroid is not a cancer, so people should not blow it out of proportion. So it's a benign growth of the womb. So if you find out that you have any of the symptoms we've mentioned, the best thing you need to do is you see a good doctor, a gynecologist. You'll be sent for an ultrasound, and then they'll be able to measure the size of the fibroid. They will be able to know the locations of the fibroid, and they'll be able to advise you on what to do in terms of if you require a surgery called a myomectomy, or you need any other line of treatment.
Okay. All right. I will go on a very, very short break. All right. And when I return, we'll talk more. Especially, I want to have a conversation with the female doctor here, to tell us more about this thing. Stay there. I'll be right back.
In a world where about 8 billion people are connected by click, there's a new way to get connected. Introducing the all-new VOP FM website, where talk meet innovations. Get ready to be tuned in.
I'm walking the bull. Tired of searching for the perfect station that matches your taste? Look no further. With our all-new easy-to-use website, you can now discover a world of conversations that resonate with you.
Whether you're a fan of news, business, sports, entertainment, or the latest chart-topping jams to soothe your soul, the VOP FM website has got you covered.
It's a one-stop destination for all your cravings.
Experience seamless streaming with our user-friendly interface. Access our website on www.voiceofthepeople.ng from any device, be it your computer,
tablet,
or smartphone, and enjoy uninterrupted talk and news at your fingertips. www.voiceofthepeople.ng.
Voice of the People 90.3 FM.
Now you have a voice!
Voice of the People 90.3 FM. In case you're just tuning in or just joining us, welcome and welcome. My name is Jude. Ikamiju there. And of course, we're looking at fibroids and of course infertility, in ladies. And of course, I've been having this conversation with Dr. Charles Adeogun here in the studio. And of course, I told you that we will be having a female doctor join us this morning on the show. And of course, she's here right now. Dr. Haruna is here. Good to have you join us, Doctor. Yeah. A-R-U-N-A. Aruna. Okay, not Haruna. Aruna. Okay, I love that. Good to have you join us, okay? Yeah, you're welcome. Okay, now we were talking about fibroid, and it's kind of prevalent and it's taking lives, especially in this part of the world. And people ask questions. Some don't even know what fibroid is all about. All they hear is fibroid, killing people, fibroid. When you have it, you go for operation. When you have it, you do that. So I would want you to also break it down for us. Help us understand in your own language, in your own way. Yeah. I can't hear her. Okay.
Fibroids are very common pelvic tumors in females, especially in reproductive age group. So it increases in incidence after 35, after 40 years of age. Okay, basically they are non-cancerous. They are non-cancerous tumors originating from smooth muscles and fibroblasts of uterine myometrium. According to FIGO, there are around 8 types of fibroids depending on the location. So we are talking about fibroids. So there are the types. Basically, it's divided into 3 mainly, which is which is closer to the endometrium, submucous, and the one which is closer inside the myometrium, that is intramural, and one which is external. The layer of the uterus, that is serosa, that is subserosal.
Okay.
So there are 3 main types of fibroids depending on the location. So mainly concerning with the infertility, the first 3 types, 0, 1 and 2 submucosal fibroids, they will have a significant effect on pregnancy outcomes and conception, difficulty in conception and infertility, those issues, and heavy bleeding, pelvic pain, and back pain, pressure symptoms, depending on the size and location.
Okay, so which of the type can kill actually? You mentioned type 1, 2, and 3. Which one is dangerous amongst all of this?
Dangerous means fibroids are not cancerous. It's only the symptoms which cause, that is the pain and heavy bleeding and infertility. Now we are concerning about infertility. So the fibroids of 0, 1, 2, which is closer to the myometrium, which is closer to the endometrial cavity, uterine cavity,
okay,
because it hinders the implantation and it hinders the growth of the pregnancy, early miscarriages and implantation failure, those things.
Okay.
So 0, 1 and 2 submucosal fibroids.
Okay. So it means when the best way to treat fibroid now, is it to go for an operation for it to bring it out, or is there a pill that one can take to eliminate fibroid?
Okay. So fibroids most commonly they present asymptomatically, but when it comes to a couple with infertility or a woman with infertility, it depends on the size of the fibroid. Even submucosal fibroid, which I have told, of 0, 1 and 2, if it is less than 4 centimeter, there is no need for like a prophylactic surgery before planning for pregnancy. Only when it causes recurrent failures of IVF or recurrent miscarriages or early spontaneous miscarriages, then we advise the woman, we go for minimal invasive surgery like hysteroscopic removal of myoma.
Must it be removed?
Yes.
Must fibroid be removed?
Yes, it has to be.
Isn't it way you could melt it there? I don't know.
Unfortunately, there is no any efficient medical treatment for fibroids. It's only the surgery that can be give 100% results. It's only the surgery that can be, it is helpful for the woman, not the medical management. Because medical management, it can only, a few studies shows that it can shrink, but it will not remove or
Completely.
Yes. And after stopping the medical treatment, the woman will rebound with the symptoms again. There is risk of increasing in size, and the complaints of heavy menstrual bleeding and the pain all will come back again.
Okay, let's talk about this idea of using traditional means, all right, to cure fibroid. I've seen several black ladies, black women go for this traditional way of treating it. You are an Indian, and I'm sure you in your country, you have several drugs, several traditional way of treating people. Just as in Africa we have that. But I want to ask you, would you want to ask people to also try a traditional method to treat fibroid?
I would personally not recommend any traditional way of treatment.
Maybe because any water or any liquid or whatever to just drink and melt it like we have.
No, because there is no any proven evidence for any traditional methods. It's only the hope that woman follows about the traditional herbal treatment and anything. But there is no any medical proven studies for those things.
You know Agbo?
What?
How long have you been in Nigeria?
I'm very new here. It's only 3 months.
Oh. Okay. Here we have something called Agbo.
Okay.
Right? It is a substance, liquid herbal mixture.
Okay.
That people tell you when you take it, it will go down to the fibroid and it will of course melt it. Or it will, I don't know if it pulls the fibroid from that location or something, but that's what they tell you.
Maybe that's a magic, which I don't know. It's completely new.
Oh, okay. Okay, so the best way now to go about, because I've seen a friend of mine had very huge fibroid. And the next thing is, they're talking about, doing the normal whatever and then bringing it out. All right? Have you experienced any occasion where someone dies in that instance?
See, though fibroids are common, so removal of fibroids, which is called as myomectomy, it's a major surgery. Because it's a major surgery which is associated with risk of heavy bleeding and infection and injury to the visceral organs.
Okay.
Infection because of the hemorrhage, blood loss. Women may sometimes there is a risk that it can be succumb to death also, depending on the size and the location of fibroids. If the fibroid was more close to the uterine arteries, then definitely the hemorrhage will be more and the risk is definitely higher.
Let's link it to fertility.
Okay.
Some will tell you the reason why you are not fertile, the reason why you cannot give birth is because you have fibroid. Whether it's little, whether it's big, you have fibroid. You have to go check. Is it true?
Yes. Even though if the fibroid is smaller, it depends on the location. Is it closer to the fimbrial end, the fallopian tubes, or the cervix, or the cornual ends, which can block the fallopian tubes, and the cervical fibroids. There is cervical fibroids also, which can restrict the internal os. It becomes obstructed, so the passage for sperms is difficult. Even that is a mechanical hindrance. It can even cause infertility.
Then what happens to fibroid during pregnancy?
Fibroids in pregnancy, usually they tend to grow because of the pregnancy hormones, estrogen and progesterone. Okay.
Okay.
So they tend to grow, and the more instances are they degenerate, like hyaline degeneration or they become softer and softer because of the pregnancy hormones, and because of this degeneration, women will have more pain. That is the most common complication of fibroids in pregnancy.
Okay.
Other things, as I said, it could be early miscarriages, or the fetus in growing in the second or third trimester.
Okay.
There is abnormal presentation of fetus, fetal growth restrictions, and the fluid level can be less. preterm labor can happen, premature birth can happen, and limb deformities for the babies. These are all the complications of fibroids in pregnancy. Yes.
Limb deformity.
Yes, limb deformities, because there is no space for the baby to move inside the womb. So when the baby is constantly in a particular position, the growth of the limbs will be compromised. So that could result in limb deformities.
Aside the limbs, what else did you mention again?
Fetal growth restriction. I
Okay.
mean, not growing to the
Size,
Yes,
yeah.
Yes.
Okay.
And preterm labors, premature deliveries, premature birth, and abnormal presentations. Like usually, head will be down in the pelvis as the baby grows. It can be transverse. The lie of the baby can be transverse, or the head can be up. In rare conditions, bleeding, postpartum hemorrhage, and placental suppression and retroplacental fibroids, which can increase the bleeding.
Okay. But then, so I've heard someone say that if you have fibroid and you are about to lose the baby as a result of that fibroid, both can come out. The baby, the fibroid can come out in that instance. Is it true?
See, fibroid, as I mentioned, if it is submucosal fibroid it is completely in the endometrial cavity. The fibroid can be attached to the endometrium with a whole, broad base or
Okay.
a thin connection like a stalk. If it is a thin connection like a stalk, along with the baby, the fibroid also can grow. If the stalk is extended, and during delivery, in rare cases, I haven't seen anything like this, but it can present as a fibroid polyp which is protruding outside the cervix. But during delivery, coming out along with the baby is quite unusual. And it's very rare.
Again, let me ask you, is it possible for a female not to have fibroid from birth to death?
Yes, it's normal. See, fibroids incidence and prevalence, it depends on the race and the environmental factors and the genetic background and the lifestyle and comorbid conditions. Fibroids are more common in blacks and Hispanics more than whites and Asian women.
Okay. Whoa. A whole lot here. A whole lot. Doctor, you want to add something to what she said?
Just as she said, genetics, race, they are important determinants of the occurrence of fibroids. And fibroids, like we said, they can present in different ways. And the important thing is, once you notice you've discovered that you have fibroid from a scan, you should see a licensed gynecologist to make sure that you are assessed and making sure that they choose the best treatment option for you. Because the idea is for you to always see a professional who would assess your case, because most times our health management is an individualistic approach, because what works for one person may not work for another person. So let a doctor see you, let a doctor assess you, and let the doctor outline a management plan for you. So if you are told you need to do a surgery, that is the best option for you, then you better follow that option, because before the doctor would choose that option, he has considered a lot
Tried
of factors.
all the other things. I agree.
And
Yes.
he's making sure that this is what would work for you and this is what is appropriate for your case. And in our environment, I just want to emphasize the fear and phobia for surgery. A lot of people think that once you go into the theater, it's a 50-50 chance of you coming out alive and all that. A lot of people have different perspective to surgeries. So it's important that if we need surgery, we should be open to it, because surgery is a valid form of treatment. It has saved a lot of people's lives. So it's very essential that if you need a surgery, make sure you are seeing the right doctor, make sure you are in the right facility where every infrastructure that you need and the amenities for a successful surgery that would manage your pre-op, intra-op and post-op management, appropriately is in place. So once all that is in place, then you are in safe hands. It's important that our people have a reorientation when it comes to surgery.
Thank you. I want to ask you the actual cause of fibroid. Hold on. Before you answer this question, everyone, feel free to ask a question, though our time is limited, very limited. Feel free to ask a question. Just send me a message on WhatsApp. 08171756338 is the number. Again, 08171756338 is the WhatsApp number. Just send in your message and I'll read it out quickly, because I might not have the time to open up the studio line to hear you talk. All right, but then I just want you to ask a question, or maybe okay, fine. Let me hold on that. Let me hold on with that. Dr. Aruna, what actually causes fibroid?
See, fibroids, as I said, depending on the ethnicity and
Why is it ethnicity? Why does it have to do with the fact that you are black? You have typhoid and fibroid.
It's not about black or white, but it's autogenic and female reproductive hormones like estrogen and progesterone, and they are, I don't know, I have to explain. It's they are women in African race, they are more hyperestrogenic.
Okay.
That could be one reason.
And
So-
then the vitamin D deficiency
Yeah,
association.
definitely vitamin D deficiency
Okay.
also, because of more melanin, the vitamin D is not absorbed.
Effectively, yeah.
That could increase the risk of developing fibroids.
Before you came in,
And
okay.
the early menarche, which is more common in blacks,
okay.
that is also a risk factor. And early usage of contraceptives, though contraceptives are not directly it's responsible for the genesis of fibroids, but
Okay.
early usage, between 13 to 16 years of age, early usage of contraceptives, it can prone, there is a risk of developing fibroids. Women who are more fertile, more parity, means carrying children of 4, 5 or more, there is a saying that the womb which cannot carry a baby, it can carry a fibroid.
A womb that cannot carry a baby can carry fibroid.
Yes,
Okay.
it's a saying from old age.
Whoa. So it means that, or let me ask you, if a woman has given birth, does she still have the chance of having fibroid?
Yes, there is a risk. It can develop any
Really?
time. Yes.
Really?
Yes, women had in the reproductive age, it increases the risk of developing fibroids. It increases with age. Between 30 to 35, the risk is around 48%, and between 35 to 40, it is 55%, and then more than 40, it is 60%. The risk increases with age.
Whoa.
Yes.
So no wonder we have ladies around 30 what now? Around 34, 30. Yeah, 30. Between 30 and 49.
Yes.
It's always high.
Yes.
Especially,
that's the major reproductive
Say
age.
from 48 to 14. 38 to 49. It's always very high.
Definitely.
Okay, let me see if I can get to read some questions. Can a lady who had a child before and then wait for about 7 years without a child grow fibroid in between?
That's what the previous answer.
Yes.
Yes, there is a risk that it can develop with age. Yes.
It can. Okay, can someone get an advice or help from a doctor concerning sexual infection? How can I contact the doctor? Okay, don't worry, just chill. You can, when we're done with the show, you know how to face the doctor and ask your multiple questions. Several other questions here. My name is Prince Sunday. Okay, is it true that ladies at age 30 and above may not be able to conceive after fibroid removal?
After fibroid removal, see, infertility is multifactorial. It's not only fibroid that causes infertility. So, when we are dealing with a case of infertility, we have to evaluate complete from the female partner and the male partner, both sides we have to evaluate. How is about the uterus, about the ovarian function and the fallopian tubes. This is for the female partner, and for the male partner about the sperm count, any infections, comorbid conditions, about the habits. This is all we have to evaluate. Ruling out everything, if fibroid only is the cause, depending on the size of the fibroid, location of the fibroid, whether we have to remove she's a candidate for surgery. After the surgery, whether she has ability to conceive naturally or she needs any further treatment, we can evaluate only after that.
Okay. Well, because of our time, we need to wrap up. There are several questions I would have asked you, but then we would invite you here again. Okay.
Sure, I'm happy to come again.
Of course, we'll bring you back here again. This time around, we'll have enough time to have this discussion. All right. I see there are several calls coming in, and of course several messages, but I will not be able to read all of them. That's why, this particular show, this episode that comes up every Thursday, is to assist or help people. All right. It's born out of the fact that something happened to me. And I don't want that to happen to even an enemy, and so that's why we're doing this, to at least assist people. So you can just go ahead to Facebook, Doctor's Mic, and ask your questions. We put that there so that you can ask your questions, as many as you can, and of course doctor will just answer you from there, because I discovered that a whole lot of persons after the show goes to want to ask questions. Some people will even send link to this one, go and ask questions. This thing that is wrong with you, God. Just go there, Doctor's Mic on Facebook, Doctor's Mic. Okay, you can go there and ask any question you want to ask. Dr. Charles Adiogun, thank you so much for coming. Thank
you for having me.
Yeah.
So we'll promptly respond to all your questions and your comments, and we'll promise you to give you the right guidelines, to get the solutions you need. Yeah, so we expect the questions to come in.
Thank you. Dr. Aruna, what do I give you as a gift? You're just 3 months 3 months, right?
Yes.
In Nigeria?
Yes.
What do you like? Have you seen anything in Nigeria you like?
No, I went to VI.
Okay.
And a few beaches.
Okay.
Beaches. You like the beaches?
Yes, I like the beaches, and the people here are very friendly. Though they are loud, but they are friendly.
See, this is Africa.
Yeah, I know.
We can be loud sometimes. Oh God. But then, okay, you love to visit the beaches.
Yes.
All right. Maybe me, you, and Doctor here will just pay, a visit to the beach any day, anytime, and have fun, of course. And you might like some of the things you see there.
Sure, thank you.
Welcome to Nigeria.
Thank you.
Welcome to Lagos.
Thank you so much.
All right, everyone. My name is Jude Ikami Jude. We'll be back here. Doctor's Mic will be back on Thursday. We do these only Thursdays, okay? Only Thursdays at this time. So feel free to ask your questions. I'm giving you the opportunity to ask your question. Go there, Doctor's Mic on Facebook, and ask your question. All right? Thank you so much. My name is